So dear friends, today we are going to discuss very important thing. Am I audible clearly? Can you hear me properly?
Yes, yes.
Yeah. So in the human body, we know there are too many organs. We are having brain, we are having heart, lungs, the different part of the brains, the front brain, back brain, side brain. So when we see the body, it's not only physical. There are lots of different connections of the body, like physical, metaphysical, emotionals. So today in this discussion, we are going to discuss various organs of the body, near about 41 organs or near about the 41 organs. Let's see how much we can complete. And not only the physical aspect, but also their psychological understanding and all. So we are going to discuss, right? So Manish,
Yes, sir.
so please, can you summarize in 5 minutes the topic of today?
Yes. Uh, this is actually a part of our chakra teacher training course where we are training the teachers to become a chakra specialist. And every chakra has some organs under it. So I want you to explain us the role of each and every organ from a psychological or a behavior point of view, how behavior is affecting the organs in the chakras. So this is our thing. That's our request for you.
Okay, wonderful. So as I got the request that I have to discuss the organ, physical aspect of the organ, psychological aspect of the organ, and how can we treat by using some Ayurveda technique, some traditional acupressure or acupuncture technique, or some Ayurveda points, means marma techniques. How can we balance that organ? So during this class, we will be focusing on this. And during this discussion, if you have any questions, you can ask. Okay. You can raise your hand or you can put in the chat box if you are having any related questions, so we can discuss that. Okay. Can we start now?
Yes, please.
Okay. Fine. Actually, in my college, there is some program is going on. If you find any disturbance, then please let me know. If everything is going smoothly, then there is no any issue. During this discussion, I will also locate certain points in the body. And if you find, oh, I'm not able to understand, please feel free to ask. Okay. Don't hesitate. Okay. If you're not able to locate that point, so please don't hesitate. Okay. Audible now properly? Audible?
Yes, it's very good. It's very good.
Okay. 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 Fine.
Yes, sir.
Okay. So as per my target, that we have target to discuss 41 organs or maybe some more or less organ as per the need we will be going through, right? So understanding the organ energy imbalance. So we are targeting the 41 organ based on their energy imbalance. Okay. And we will be also focusing how to balance them using acupressure, acupuncture, marma therapy, some naturopathy ideas. Okay. So we can tell in one word that we are going to understand the language of organ. Excuse me. So every organ is having one language. It's not only the physical language, it's an emotional language, it's a somatic language. So we are going to discuss that. So we will be understanding organ energy. If the organ is balanced, then what will happen? If the organ is imbalanced, then what will happen? If the organ is having high energy, then what will be the effect in the human body? If the organ is having low energy, then what will be the effect in the human body? Okay. So we are going to understand the organ energy. Okay. Then effect of the imbalance. If the organ is having high energy, what symptom will be appearing in this human body? What disease will be appearing in the human body? And healing techniques, then how to balance them. So number one, understanding the organ energy. Number two, understanding the imbalance. And number three, how to balance them. So these are the three targets during this discussion. And we are going to use acupressure, marma, ayurveda, naturopathy, everything means in the alternative therapy. Okay. So why this knowledge matter? Why we are going to discuss this? What is the importance of this? Because when any disease happening in the human body, there are early warning signs. Okay. So if we see the early warning sign, like suppose if we are going to some Ayurveda doctor, the Ayurveda doctor checking the nadi, the pulse, and they're understanding, okay, in the means you are having some dosa imbalance, you are having some imbalance, then in the future there are chances to suffer with this problem. But everyone is not expert in the nadi pariksha, in the pulse diagnosis. So body is also showing many warning signs. And if we understand these warning signs, then we can also work for the disease. Okay. So we will able to detect early warning sign before the symptom appears, before the symptom manifest. So we can make the customized treatment plan. And again, I will repeat, we will able to make the holistic formula to balance this. Okay. So there are too many marma point in the human body. This is just a general representation that how the many marma points in the human body, like we can see, this is the third eye, in the crown chakra. Okay. On the side, we are having many marma points in front of the ear, on the back side of the ear, on the face, and they are having some name. These names are written in the Sanskrit language, and each and every marma point also very helpful to balance these organs. So other than acupressure points, we will be also trying to learn some marma points. So these are the organs we can see. One, two, the list of the organs. Too many organs given here. What will happen if they are having low energy? What will happen if they are having high energy? And how can we balance with the acupressure point? So this is the entire chart. So we will be providing you at the end of this discussion. So, okay, lung is having imbalance. What will happen if the lung energy is low? What will happen if the lung energy is high? And how to balance using some acupressure point or some normal method, like it's written here, the Tulsi tea. Okay, so how to balance them? So this is the entire chart, include all the 41 organs. Okay, so let's start from the one. So this is the one. So 1 to 41. There are total 41 written here. So let's start from the one, that is cerebellum. So this is the cerebellum. The cerebellum, also called old brain. So where exactly it's situated in the brain? If you look at the brain here, so this is the brain, right? So we are looking the brain from the front side. Okay. So this is the front side of the brain, or we can see whatever we can see, the part of the brain, this is called cerebrum or the master brain. The cerebrum or the master brain is connected with the concentration and intelligence. Okay. But our focus is not the cerebrum, so let's turn the image. Now we are going on the back side. So this is we can see cerebellum. Cerebellum, or we can tell a small brain. The other name of this brain is also called a reptile brain, or we are telling it old brain. This brain is having connection with the balance and the coordination. If the person is walking, how the person walking with a very good balance, like we can see many person are doing some training of the cerebellum, so they can walk on the rope, or they can do the work with a very wonderful balancing. Now we can see there are many animals like the monkey or some other animals having very good and developed cerebellum. So they are having more, they can use the cerebellum more efficiently than the human. Like monkey can jump from one tree to another tree, but human can't jump in the same way like the monkey. So cerebellum is the part of the brain, it is called old brain, reptile brain, and it is having connection with the balance and the coordination. If there is a disturbance in the cerebellum, then person will be getting the problem that is called imbalance or the lack of coordination. So this condition is called cerebellar ataxia. The cerebellar ataxia, like person is walking like a drinkers. You might be have seen when the drinkers is walking, how they walking like this. If the person is getting any problem in the cerebellum, then person will not able to walk with the coordination. Person will not able to perform the work with a very good coordination. So in this, we are also telling the cerebellum the old brain. Okay. If the cerebellum is having low energy, what will happen? If the cerebellum is having high energy, what will happen? If the cerebellum is having low energy, then person is feeling burdened with the past. So person is engaged with the past happenings and unable to control our destiny, just in thinking about the past and indulge in the past. Okay, and feeling like he is not driving his life. Someone else is driving their life. And definitely they are suffering with the loss of balance and the dizziness. If the cerebellum is having high energy, then again person is being forced to deal with the past burden. And person might be having headache and the dizziness. Why the cerebellum get disturbed? There are many reasons. Number one reason, there might be trauma, there might be some injury. But the other, like we can see, chronic stress, too much stress. Okay. And some external force controlling you, long-term suppression of the emotions. Okay. And all. So this is not only that vestibular system, means there is some imbalance in the ear or excessive screen timing. Nowadays, we know the screen timing is very much high. So we can see the imbalance in the cerebellum. These are the poor posture and many other things. So how can we balance the cerebellum? So there are very wonderful 3 points in the acupressure. There are 2 very good marma point and some Ayurveda remedies. We will able to balance the cerebellum. We will bring the good balance and will able to work on the dizziness. Will make the free person from the past burden. So there are 3 points: gallbladder 20, governing vessel 16, and the Li4. They're very easy to locate, I will tell you. Let's talk about the Li4. If you look at my hand, if I just add my finger, we can see the muscles here. This is called interosseous muscles. Exactly the peak of this muscle, the top of this muscle, if you see this muscle at the peak of the muscle or the top of the muscle, that is the location of Li4. So we have to press this point. So we can press in this way, press 1, 2, 3. I'm counting 1, 2, 3 means till the time 1, 2, 3, you have to keep pressing this point. Press 1, 2, 3. Press 1, 2, 3. In this way, you have to press it 15 to 20 times. I will also show the location of this point here. Are you getting some disturbances from the surroundings?
No, everything is good.
Okay, yeah, fine. So let's see the location of this point here. So this is called Li4 or Hegu, and this is the location of this point. In the acupressure or the acupuncture, the very famous point and located on the tip of the interosseous muscle. Okay. And my all the acupressure friends are knowing that what is the contraindication of this point. What is the contraindication? My friends, yes, tell what is the contraindication? Monica ji?
Not to use during pregnancy.
We should not use this point during pregnancy in the China, where the population becoming very, very high. So the soldiers used to stimulate this point for induced abortion. If you press this point very vigorously, then it might induce abortion. So it's a contraindicated point during pregnancy, but anyone else can tell me it's a very good point for, no, not Monica, anyone else.
It is an antiseptic point, sir.
Pain
For
relief,
pain control, we can
analgesic
use it.
point.
It's the pain, yeah, it's the painkiller point. If the person is suffering with a pain anywhere in the body, any part of the body, pain of the tooth, pain of the head, pain of the back, pain of the knee, pain anywhere in the body, the Li4 is one of the great point as a painkiller. So number 1, we are not using it during the pregnancy, but we can use for inducing the labor. We can use this point for inducing the delivery, but please don't try delivery without having proper knowledge, right? Because there are many other combinations. So Li4, and we know it's a very good painkiller point. Li4 we are not using during pregnancy. It's a very good point for cerebellum. Now, 2 more points for the cerebellum. Let's see 2 points. So if I follow this midline, I am following this midline, and I keep going till the end of my brain. Then I'm reaching here and I'm feeling the depression here. So this is the depression. Okay. If I go deeper from this depression, near about 2 inches deep, then I will reach on the cerebellum. So this is the another point, and this point is also called governing vessel 16 or GB16. So this is the second point. It is called governing vessel 16. I will show you the image. It's a very good point for cerebellum, and it's located exactly above the cerebellum. Let's see now. This is the point. So we can follow the neck, the upper part of the neck, and we can find the depression here. And this is the depression, or called DU16. DU16. So as per the acupressure, what is the importance of DU16 and when we can use it and when we can avoid it?
That it removes
Number one,
wind
this is a
from
very
the
good
head.
point for cerebellum. I told you.
That it
In the
removes wind from
acupuncture,
the head area.
this is called the point of grandma. You know grandma, Dadi Amma. This is this
Dadika.
called the point of grandmother. Why the point of grandmother? When you are having, oh, I'm feeling some stiffness. Then grandmother pressing this point. Then grandmother pressing this point, and you are feeling, oh, I'm feeling much relief. Thank you so much, grandmother. So grandmother is having experience that this point is very good for neck pain. But right now our focus is not the neck pain. Right now our focus is cerebellum. So when we are pressing this point, it's a very good point to balance the cerebellum. It's a very good point for balance and the coordination, right? In the Marma Shastra, in the Marma Shastra, there is one part that is called Marma Kalai. Marma Kalai means we are not treating someone, we are hitting someone to create the damage. So when we hit this point, DU16, then tongue is coming out and person losing the speech. So DU16 is one of the great points for not only cerebellum. If we hit this point with a bad intention, person will lose the speech. But if we press this point with a very gently, very smoothly, or we needle this point, or we do acupressure on this point, then even the person not able to speak, we can see good effect in the speech, because this point is having direct connection with the tongue. So this is another point which is called the point of cerebellum. Now third and the last point here, that is called gallbladder 20. Gallbladder 20. So let's see where is the gallbladder 20. You can see this is my muscle. Okay, this is muscle. This is called SCM or sternocleidomastoid muscle. If I follow this muscle and go upward, then I will reach on the backside on this point. I can feel the depression here. This is the junction of the skull, where the skull is ending on the side. I can feel the depression here. So I can feel this depression on both sides. So this is called gallbladder 20, GB20. So let's see the location of this point. GB20 is a very good point for dizziness. GB20 is very good point for cerebellum, because cerebellum is having connection with the dizziness. So we can see here, this is the gallbladder 20. The name is Feng Qi. In the Chinese, we are telling it Feng Qi. So we are telling this point is located between the skull and the sternocleidomastoid muscle here. Feng Qi. So the meaning of Feng is binder. The point who expel, bind. So that is called Feng Chi, right? This point is also called the pool of wind. Pool of wind, like the swimming pool of wind. So when we are stimulating the gallbladder 20, what is happening? It's expelling the unwanted wind, unwanted air. Then if the person is having some vertigo, some dizziness, and will see very good results, even it's a very good point for headache. So we have discussed 3 points. Okay? Remember all the 3 points? Number 1 was
Li4.
Li4. Number 2 was
DU16.
DU16.
DU16. Number 3
16.
was
16.
GB20.
very good.
UB20. UB20.
Done. So we have discussed these 3 points and this is written in the PDF. So don't worry, I will provide the PDF. So you will able to understand. So right now we were discussing how to balance these points using the acupressure. So these 3 points over. Now these few points will repeat again and again. Then I will not repeat again entire location and all. So remember these location right now. Okay. Now regarding the murmur therapy, if there is a problem with the cerebellum, how can we balance using murmur therapy? Okay. There are very two good point. One is Sankha Marma, one is Agya Marma or the third eye Marma. So I will show you this image here. Let's see now. Let's see this. So the one Marma point, this is called third eye Marma. And another point is called, this is Sankha Marma. Sankha Marma. Okay. So these 2 points having connection with the cerebellum. Fine. So third eye marma, like we are putting the tilak here. This is the tilak on the third eye marma. It's a balancing our pituitary gland, pineal gland, cerebellum, cerebrum, the multiple part of the brain. And the another point is third eye marma. If you see this is the specs. And if you see the stick of this specs, okay, this is stick. So where this stick crossing my hair, that is the point of Sankha Marma. Sankha Marma. Right? So we can understand from the eye, from the corner of eyes, if we are going to the top of the ear, where this point touching the hair, that is called Sankha Marma. So we can just do the acupressure here. We can do just Marma. How to do the Marma? We are using the pads. We are not using the tips. We are using the pads. We are keeping the pads on the points. Then just we do a rotational movement. You can see here. I'm not rubbing my finger. I'm not rubbing. I'm just doing a gentle pressure, touching this point, then doing the very gentle stimulation. Make sure you are doing very gentle, because if we are stimulating the marma point with the intense pressure, with the more pressure, then this pain will remain for 2 days. So in place of giving some benefit, we will be creating the pain. Then person will not be comfortable. So all the marma point should be stimulated very gently. So just keep the finger, press very gently, and then just do the rotation. Right? Bilateral you have to do. You can do clockwise, anti-clockwise. So stimulate this point for 30 seconds to 1 minute. This is called Shankha Marma. Now coming on the third eye, keeping the middle finger here and pressing this point and lifting 3 times up. 1, 2, 3. Or we can do 1, 2, 3 over. So this was the stimulation of these two murmur points. Let's move to the how can we work as per the Ayurveda. In the Ayurveda, if we want to work on the brain, if we want to work on the cerebellum or the small brain or the reptile brain or the old brain, there are very good medicine, Brahmi, Ashwagandha, and Sankha Pushpi. Kindly mute yourself.
ಅದು ಲೂಸ್ ಆಗುತ್ತೆ ಅಂದ್ಬಿಟ್ಟ.
Please mute yourself. Those who are speaking.
Sir, you are the host, so you can mute all of them.
Okay. You can unmute yourself only when you ask the questions and immediately mute. Okay. Don't keep yourself in the unmute conditions, right? So now we can go here. In the Ayurveda, Brahmi is one of the great medicine. Ashwagandha is one of the great medicine. Ashwagandha is very good for stress. Ashwagandha is very good for brain. Each and every part of the brain is including cerebellum and Sankh Pushpi. Like in India, Sankh Pushpi is very good, famous for mental clarity and all. Then Shirodhara and some yoga posture, like balancing yoga posture, like tree pose or the Brakshasana can be done. Okay. Regarding the Shirodhara, how many persons are knowing the Shirodhara, have heard the Shirodhara? Just raise your hand. Do you know Shirodhara? Manishji, your participant
So
knowing what is
we are
Shirodhara?
only into yoga. We are only into yoga.
So shall I demonstrate Shirodhara for 2 minutes?
Yeah, please.
Okay. So fine, I will show you how, just in the Ayurveda, how we are doing Shirodhara, and it's a really very, very good for brain. Let's see here. Shirodhara is very good treatment and which is very good for all the mental disorders. So let's see now. Just I'm doing a quick demonstration for 2 minutes. So we can see here in the Shirodhara, we are putting the oil stream on the forehead. We can see how the oil is going. It's a very famous treatment of the Panchakarma or the Ayurveda. And it's stimulating the multiple part of the brain. And we are doing this treatment for all the brain disorders, as well as all the hair problems. We are also choosing the oil as per the condition, right? The person is having different problems, then we are choosing different type of the oil, okay? Because many person coming with the dizziness, vertigo, some person coming for the benefit of, they are having hair fall, or many different type of the neurological problems. We are doing Shirodhara, right? So this is the, quickly I am forwarding, fast forward. So there are many different movements we are doing. Then we are squeezing the oil out. Okay, done. Clear? Got little idea? Okay. So whenever, if you have not experienced Shirodhara, you can go in some Ayurveda Panchakarma clinic and experience once. It's very good. So now let's move to the organ number 2, that is cerebrum. So cerebrum or the young brain. Like we have seen, the cerebellum is the old brain. Okay. The cerebrum is the young brain. If you see this image, in this image, we can see this. This is the front part of the brain. This is the back part of the brain. Just we have seen cerebellum. At the front part of the brain, which is called cerebrum. Cerebrum is having many parts. This part, this part, this part, many parts. So cerebrum is the combination of many parts. And this is called master brain, which is having connection with the intelligence, reasoning, focus, like skill of math. If the person is not good in math, then maybe having some problem in some area of the cerebrum. So this is the cerebrum or the master brain or the young brain. So the thinking process, if we are praising someone, oh, you are very intelligent, it means we are praising the cerebrum. So cerebrum is having two parts. The right part of the cerebrum and the left part of the cerebrum. Okay. So now look at here. So cerebrum or the young brain, it's having connection with the intelligence, but also it's get disturbed due to the stress. The stress is the factor who is disturbing a lot. So person is intelligent if the cerebrum working very nicely, but if the person is very much stressful, it will be disturbed. So if the low energy of the cerebrum, person is having tiredness, exhaustion, then concentration will get disturbed and motor functions will be disturbed. If you are not doing motor function, please you can ask me. If the high energy is there with the cerebrum, then it will make you very intelligent, very intuitive, and the high creativity. Okay. So we are having two parts of the cerebrum. One is the right part of the cerebrum, one is the left part of the cerebrum. So the right part of the cerebrum is having connection with the creativity. Right cerebrum is having connection with the creativity. Right cerebrum is having connection with the intuition. So the right cerebral hemisphere having connection with the spirituality, intuition, and connection with the higher consciousness. And left cerebrum is having logical thinking like maths, logical thinking. So generally we are telling the males are using more left brain and females are using more right brain. This is a general concept. The male will be using left brain more and the females are using right brain more. So the males are having more logical thinking and the females are having better intuition. Okay. But it's not always necessary. Some person might be having balance. So our responsibility, that we have to balance both the brain. If we are balancing both the brain, then we can work very nicely. So suppose we are drawing, we are doing some painting, we are doing some creative work, we are activating our right brain. So overworking of the brain or the excessive mental stress or the person is not able to sleep, then person will be suffering with the cerebrum. Here very important thing written. So hormone imbalance also having very great impact. there is a, we know there is a very important gland, that is pituitary gland here. Okay, pituitary gland. So pituitary gland is very deeply connected with the cerebrum. So right brain is the emotional brain, intuitive brain, spiritual brain. Left brain is the logical brain, who just do the calculation. Oh, I should do this because this is beneficial for me. If I give 100, I will get 150. Oh, this is good for me. So left brain is always thinking with the logic, but the right brain is not thinking with the logics, right? It's a purely intuitive. How to balance? So few points are, the first point will be, I will start from here, yin tang or the third eye point. Yin tang or the third eye point is common and will come again and again, right? Fine. Even in the Marma Shastra, we are telling third eye reason. Praise this point in the Marma Shastra. In the Marma Shastra also we are telling, okay, praise the Agya Chakra. In the acupressure also we are telling yin tang point. Yin tang point is this. This is the point. Yin tang. Between the, or third eye point, between the eyebrows, this is the. So yin tang point is the very important point. Even we are inserting the needle here to improve the concentration, to improve the consciousness. We are telling if the energy is moving upward on this point, then person is very aware and having more intelligence, more concentration. So what we do, we are taking tilak and we are putting like this in the upward direction or like this. We never put anything in the downward direction here on the third eye point. Have you seen doing like this? We always put tilak like this. We are improving the concentration, but do not overstimulate this point because this point is higher sensitive. If we do the overstimulation of this point, then this point will get disturbed. So this is called third eye point. And the next point, which is connected to the cerebrum or the master brain, the top of the brain. Top of the brain. So following the ear and going on the top, this is the point of higher consciousness or the point of Sahasrara chakra, the point from where we receive the cosmic energy. We receive the spiritual energy. This is the point. In the acupressure, we are telling it governing vessel 20. From there, the energy from the cosmos entering in the human body. Or we can consider when we are doing meditation, we are keep your body straight, spine erect, head erect. We are telling so that we can receive the energies that is called etheric energy. Etheric energy is coming from the D20. So we are pressing this point. It's a very important point. DU20 or the governing vessel 20. This point is called the great tranquilizer point. Tranquilizer. When I am giving Marma therapy to someone, I have seen if I'm keeping the finger here, suppose I am doing this technique, that technique, maybe spending 15 minutes or so. After that, if I am touching the finger here, then person starts snoring. He go in the deeper sleep. This is a very good point for tranquilizing the mind, bringing the deeper level of the relaxation. DU20, governing vessel 20. Let's see this point, location quickly.
आप गलत रास्ता पे आए हैं।
कौन सा?
ये ये क्लब का
लोग भूल जाते हैं बार बार अपने आप को म्यूट करना। So let's see this point here. This is called DU20 or the governing vessel 20. Exactly, we are following the line of the ear, or from the hairline, it's 7-finger back. Suppose you want to measure from here. You can go from the hairline and you can count 7 fingers. In the acupressure, we are telling 5 fingers. We will reach on the DU20. In the Ayurveda, we are doing we are doing many treatment here just to balance the brain. I will show you one. What we do, we take some very good oil, the oil which is very good for brain, and we apply the oil here. So let's see now. This technique is called Cerebellum. I will show you quickly. Cerebellum. We can see here. Oh, this is the Sirodhara, right? So you can see this is the boundary we are making around the head, and we are filling the head with the oil. And we can see here, this is the Cerebellum. We are keeping one, this is the cotton cloth. We are keeping on the head and we are making hole exactly where on the center. So we are making the hole, like we can see this is the hole. So we are taking one cotton cloth, we are making the hole at the center, and this cloth also we are dipping in the oil, some Ayurveda oil, and in the center we are putting more oil. Keep putting, drip by drip, means drop by drop, like this. It's a very good point. In the Ayurveda, that's a very wonderful. All the points we are stimulating with a very gently, very smoothly, without putting needles, without doing too much unwanted pressure. It is an excellent treatment, because suppose one small kid is coming now. Some small kid is coming to you, having 2 years of age or the 1 year of age and suffering with a cerebral palsy. You can't do all the treatment like with lots. We do acupuncture treatment, no doubt. But this treatment is very smooth. Just we can do very smoothly, everyone like. So in this way, this was the second point what we discussed. Governing vessel 20.
Sir, shall I ask some questions, sir?
Yeah, please ask.
Sir, will this treatment be good for the autistic children?
Yeah, definitely. It's we are going to discuss the different part of the brain. So first you have to see exactly the which part of the brain is involved. But this point is the governing vessel 16 is very good for autistic children. Just we discuss the point. This is a very good point for all the brain related disorders, all the neurological problems, for the Parkinson, for the autistic children, for the insomnia patient. This very good point. This point is called the great tranquilizer, right? So third eye point is also very good for these. Third eye point
Sir,
also.
we can do little tapping also over there, right? On DU20.
I will tell you.
Tapping.
I will tell you what to do. Give me 1 minute.
Even this oil massage can be used, sir, for about 9 years old child.
Yeah, I will tell you what to do. Take the coconut oil. Coconut oil, everyone knows coconut oil. So suppose we are taking coconut oil and put castor oil. Castor oil should be 1/3. Understand 1/3? Suppose we are taking ratio. If take the 1 spoon castor oil, then 3 spoon coconut oil. 1, 2, 3. This is the ratio. Then take this oil and put on the DU20. It's an excellent stimulation of this point. If you put in the night, suppose you are scared, many person is not liking to put the oil. Okay, put little oil on. Little only on the DU20. Don't apply anywhere else. Just on the DU20. You put in the night and you will see in the morning, you will see the effect. What the effect will come? Suppose you are putting water on the root of the tree in the night. Okay, you are putting some water on the root of the tree. Morning, you will see the effect. Wow, tree has absorbed the water. In the same way, when you are putting the oil here, the combination of castor oil and the coconut oil, and even any other Ayurveda medicated oil, then you will see in the morning itself, oh, something, I'm feeling much better. This is I'm telling for you. But if you put for the kids having autism or some mental related disorders or some patients suffering with some neurological problems, we will see it will heal the cerebrum. Okay, it's one of the great points. We are asking, if a person is asking, oh, I'm not able to focus, I don't have mental clarity, then I'm suggesting them, okay, do this. Many kids are coming with a mental retardation. I'm telling them, okay, do this. If you want to improve the memory and concentration, do this. Especially 3 points. 1 point here, 1 point here, and the 3rd point on the hairline. 1, 2, and 3. 3 points we have to stimulate to activate this entire cerebrum. So this is the point that is called DU24. So let's see the location of DU24. So we can see DU20. This is DU and GB are the same thing. GB means governing vessel. And we are also telling do mine. Okay, so sometimes we are telling DU. So whether we tell DU20 or the governing vessel 20, both are same. So governing vessel 20 on the top of the head we have seen. Yin tongue or the 3rd eye point we have seen. Now we are talking about the governing vessel 24 on the hairline. So let's see.
सर मैं पूछ सकती हूँ?
एक
Question?
minute, let me finish this, then you can ask. Just give me 1 minute.
Okay.
So let's see now. So we can see here 1 point on the top of the head, that is DU20. 1 point on the hairline. So this is the hairline. From the hairline, if I go half turn back, then we can see DU24. The DU24 is also a very good point for the brain. And we know in India, every female is putting after the marriage, females are putting the sindoor here, some red color here. So this is the stimulation of the brain. And there are many other effects of this point. But right now my focus is this. We are using 3 point, 1, 2, and 3. Okay, one more thing I will like tell you. So look at here. So in the acupressure, 3 point, 1, 2, 3. How to stimulate the point? We can just do the acupressure here. This is the point. We can just press this point and do the rotational movement or press the point very gently. Press 1, 2, 3, relax. Press 1, 2, 3, relax. Press 1, 2, 3, relax. Do the 15 to 20 times. Then coming here, press 1, 2, 3, relax. Press 1, 2, 3, relax. Do the 15 to 20 times. Then this point. Press 1, 2, 3, relax. Press 1, 2, 3, relax. This is the way of acupressure. Now the same point we will stimulate with the murmur technique. Like 1, 2, 3.
Huh?
Keep the middle finger here.
एक मिनट
Please mute yourself. Please mute
वो
yourself.
चाहिए भाई लेक्चर
So whenever you asking something, you देखो it is disturbing the class. Okay. फिर मैं सबको permanently mute कर दूंगा. फिर आप कोई क्वेश्चन नहीं पूछ पाएगा. You have to mute yourself. Okay. When you want to ask something, unmute, then quickly mute. Okay. So in the Murmur style, how can we stimulate this point? All the 3 points. Number 1 point here. 1, 2, 3. Then this point. Keep the middle finger here. 2 finger on the side. Zigzag. 1, 2, 3. This point. 1, 2, 3. Okay. In acupressure, we are just press, release, press, release, press, release. But in the Marma Shastra, lift it up, horizontal, horizontal. Because Marma Shastra, in the Marma therapy, there is a special direction and we have to stimulate the point in some special direction. Okay. Suppose I want to stimulate all the 3 points with the Marma, how will I do? Let's start from here. 1, 2, 3. 1, 2, 3. 1, 2, 3. Now, from here to here, there is a one suture. This is the parietal bone, this is the parietal bone. There are 2 parietal bone, the right parietal bone and the left parietal bone. And in the between the parietal bone, we are having one suture. I will separate the suture. So I will keep finger here. I will keep the finger here. I will properly grasp it and I will separate with each other. This is called separation of the suture. So let's see here. Stretch 1, 2, 3. Stretch 1, 2, 3. I will do 15 to 20 times. So this is called Simant Marma. Simant Marma, I will show you. It's written here.
Sir, can we do for 5-year-old child who's having ADHD?
Yeah, very good question. I will tell you. Give me 1 minute. Just 1 minute. As per the age when we can do it. So let's see here. It's written Simant Marma. What is the Simant Marma? Simant Marma means junction. One parietal bone here, one parietal bone here, the junction. So let's see here. So Simant Marma means this is one side bone, this is the other side bone. We are separating the suture here in between. So they are called Simant Marma. Actually, Simant means border. So exactly what we are doing, we are trying to separate the border. This is the one bone, this is the another bone, and in between we are having border. So we are trying to separate the border. Now regarding the age, when we can do. When the small baby is taking birth, these areas are very soft. Sometimes these areas very, very soft. They are not developed properly. And we can see some soft area here. Okay. We can see some soft area. And these areas are filling some in the 6 months, some in 1 year, some in 1.5 years. Means till the 18 month. So when the small baby till the age of 2 years, don't try to separate these borders or the Simant. Okay. But at the age of 5 years, we can do easily. There is no any issue. Because at the age of 2 and 2.5 years, we can see this fontanel are getting close. They are called fontanel or the soft place. If the baby is taking birth, have you seen this? Very, very soft. Have you seen anyone? This area very soft. Have you seen?
Yes, sir.
Why soft? Can you tell me why these soft? When the baby is taking birth, actually few doctors are gynec doctors, they are knowing that, but still I'm telling. When baby is taking birth, baby has to come out from the pelvic cavity, from the vagina. And vagina is small. So baby has to compress the head. Okay, baby has to compress the head. That is called molding process. Then it's compressing the head, then coming out. It's required great effort by the mother as well as by the baby. So the suture are also overlapping. There is a lots of compression. Baby is coming out, right? So that's why the suture are the God has made in the way after the birth. Then slowly, this many areas are filling. Otherwise, it's very difficult. Baby is having this much head, then how will come out? Okay. So in this way, this is called Simant Marma, and we have to. So this is a very good activation of cerebrum. Okay. Any
So
question?
one more question, sir. One
Yeah.
more question.
Yeah.
Sir, in the Marma therapy, you asked us to do some movements. It has to be done only for 3 times or more we can do, sir.
No. In the Marma also we can do many times, like 15 to 20 times, or sometimes more than that. But this point is very much sensitive. I will tell you, in the childhood, we used to play like this. Okay, do 100 times. 1, 2, 3, 4. If you do 100 times, this skin will burn. I have experienced that. Have you done? Anyone done? Anyone having dare to do?
यस सर बचपन में ना ऐसा होता था कि ये लगाओ देखो यू विल गेट रेड तिलक तो फिर वो ऑटोमेटिकली स्किन वहां से हट जाती थी ना इट
If
गेट
you do
डैमेज
100, if you do 100 times here, nothing will happen.
यस ओवर
You
हियर
want
इट
to,
विल
if you want to try na the effect of Marma point, then you try. But then
परमानेंट टीका लग जाता था
if you do 100 times here, 1, 2, if you rub 100 times, you will start getting burning, and you will get burning of the skin, even the red mark. And then it might not go for. One of my patient told me he has done many years back, still that mark is there. So don't try, please. Okay, don't try this. Why? Because Lord Shiva is having third eye here, Lord Shiva. And you know, when this is the place of fire, this is the place of consciousness. So we have to stimulate this point very gently. Okay. This is called third eye, Agya Chakra. So don't overstimulate the point. That's why I'm telling 3 times. Okay, I know I'm telling 3 times. You might go for 10 times. You can go for 15 times. But I'm sure you will not go 100 times. Okay. If
Sir,
I'm
can
telling 3 times,
can
you can go a little more. There is no issue. But don't stimulate this point more than that.
Please show one more time.
sir one question.
Yeah.
Sir, can we do Gosha gently from the third eye to the U24 and then that way upwards?
Yeah, you can apply oil and you can do very little gosha. Don't overdo.
Okay.
Don't overdo
Okay.
it, right? Okay, let's move to the next point. So now we are coming to the third point. So as per our 41 organ, the third one is the forehead. Forehead or the frontal brain. Okay. Again, forehead and the frontal brain. So this is the forehead. Forehead is the connection with the powerful manifestation and the attention. Okay. In the forehead, we are having frontal brain. So we can see here, this is the brain. So if we look at the brain here, this is the frontal part of the brain. Frontal brain. Then we are having parietal brain. On the ear, this is the ear on the side. On the side here, we are having temporal brain. So we are talking about the frontal brain. The frontal brain is having connection with the concentration. Frontal brain is having connection with the intelligence and concentration both. You are able to make good attention. So you are having If the frontal brain is having low energy, then there is a poor attention. Okay. Then the poor decision making power, and you are having very difficulty to adapting the new situations. If the frontal brain is very much balanced, you are having the power of powerful manifestations, and you are having very good attention. Okay. If the frontal brain is having high energy, then it will improve your vision and manifestation. I already talked, and very good awareness. That's why I told, if we are putting the tilak on the third eye, it's improving the awareness. Ultimately, we are treating our frontal brain. What are the cause of energy imbalance? So we are very tired mentally, okay, or we are having chronic stress, some emotional suppressions, too much imagination. You are just daydreaming. Too much imagination, unwanted imagination, your unrealistic imagination, and too much analysis, then you will get tired. Like frontal brain means like Arjun ki tisri, Arjun ki concentration like Arjun. So concentration like Arjun means one target. You know, this is my target, and you are focusing on that. That is the work of frontal brain. If your frontal brain is disturbed, then you have multiple thoughts. You are not able to focus. So let's gather the energy. How to gather the energy? First point is third eye or the yin tang. The second point will be just from the midpoint of the eyebrow, go 1 inch above, 1 inch above. So 1 point here, 1 point here. Our saints are putting chandan like this. So when we are putting the chandan here, sandalwood here, some cooling herbs here, it's calming down the frontal brain. It's improving the frontal brain. So the 1 point here, third eye, we are discussing again and again. And 1 point from the midpoint of the eyebrow, we are going 1 inch above. That is called gallbladder 14. So there are 3 points for the frontal brain. The third point is very important point. In the acupressure, we are considering this lower arm from elbow to finger like this. Elbow to finger. We are considering full body. Full body. You want to treat head? Treat here. Throat? Treat here. Abdomen? Treat here. You want to treat the genital part? Treat here. So in the acupressure, acupuncture, we can consider the full body here, head to toes. You want to work on the head. This is the point. This is called LI11. LI11 is a very good point for headache or the frontal brain, even the frontal headache. So if we bend the elbow, we can see the crease, the outer crease point. If you are having too much stress, unwanted thinking, unwanted imagination, you are daydreaming. Sometimes thoughts are not in the control. Don't worry, just start pressing this point. It will control your frontal brain. Treat this point and treat this point. Okay, let's see all the 3 points quickly. So first I will show you LI11. So in the elbow crease, the outer point, that is LI11, we can see when the crease is ending. So this is the location of LI11, which is a very good point for frontal brain, as well as we are using this point for high blood pressure. It's a very famous point for high BP also. Okay. So when the person is suffering with a high BP, how we stimulate this point? We are keeping the one hand here, one hand in this inner crease. So inner crease and the outer crease. And just keep pressing. 1, 2, 3, 4, 5, 6, 7. It will activate your frontal brain. It will activate your pituitary gland. Pituitary gland secreting one hormone, ACTH, which is acting on the adrenal gland. Then BP is rising. If the person is having blood pressure, so when you stimulate the LI11, you are working on the pituitary gland. Then it will not overstimulate adrenal gland. So we'll see quick results on that. Within 1 or 2 minutes, you will see the blood pressure is reducing in a 1 or 2 minutes. Okay. So second point is so first point was LI11, just we have seen. The second one I will show you gallbladder folding. So from the eyes, from the midpoint of the eyes, we can see here, if we are going 1 tune above, then this is the point, gallbladder folding. Yeah. Okay. So bilateral, we are stimulating this gallbladder 14. We can stimulate the third eye and the LI11. The 3-point combination, very good for frontal brain. So in the Marma Shastra, in the Marma therapy, okay, we will be definitely stimulating the third eye or the Agya chakra, but we will be working on the forehead region. How to work on the forehead region? So there is a frontal bone. In the frontal bone, in the center, there is one suture. Okay. So this is the frontal, actually frontal bone is one only, but still we are having one suture in the frontal bone, which is separating right side, the left side. So we'll separate the suture. Frontal bone start from here, and it's not ending here. It's a further going over that 3 finger away, and the frontal bone is from here to here. This is the frontal bone. So we will keep all the 4 finger here. Then again we will start separating this. So first you grasp properly, then separate. 1, 2, 3. Separate. 1, 2, 3. Separate. 1, 2, 3. Separate. 1, 2, 3. In this way we have to separate this. So point number 1, point number 2, point number 3, and as per the Marma, we will also add this separation. So this will also, if the person is having some tension headache, and in the tension headache, it will be looking at something wrapping around like this. Then we can work with the help of these points. So let's see now. So this is the third eye point. Just we have seen it's a very good point for calming down the mind. Gallbladder 14. Gallbladder 14 we have seen. The point above the eyebrows. Okay. LI11 we have seen on the elbow. Then third eye region and the forehead region. Separation of the suture. In the Ayurveda, we are using some oil like Brahmi. We are using some medicines, Brahmi and Guduchi. And Shirodhara, just I already demonstrated you how to put the oil on the head region. Okay. And if we want to develop your frontal brain, solving the puzzles, or do some constructive thinking and practicing mindfulness. So in this way, we can work on the frontal brain. Is it clear? Any question? No. So now we will be moving to the next brain, that is temporal brain. So the temporal brain so look at this image. So we can see here, this is the frontal brain, frontal bone. On the top, this is the parietal bone. These two are the parietal bone. In between the parietal bone, we can see this suture, zigzag, zigzag, zigzag. This is a suture. Now, on the side of the parietal bone, we can see here this is the temporal bone, temporal. So temporal bone on the side. Inside the temporal bone, we are having the temporal part of the brain. And our ear is located here. Ear will be here. So now we are discussing about the temporal bone. This temporal bone is having connection with if the temporal bone is disturbed, person is having too much daydreaming, person is having mistrust if the temporal energy is very low. Okay. So the person having unwanted aggression. So angerness, aggression will be there if the temporal bone is disturbed. We know as per the acupuncture, the meridian who is crossing this area, that is called gallbladder meridian. You can see this image. So this is the gallbladder meridian who is crossing this temporal area. How this gallbladder meridian is supplying the deeper part of the brain, right? See. And if there is any problem in the temporal bone, it means there are problem with the gallbladder meridian. The gallbladder and the liver meridian having connection with the anger, unwanted aggression, and all, right? So the psychological aspect, mistrust, fantasizing means unwanted daydreaming, aggression, and even person is having impaired smell and hearing because ear are here, ear located, having connection with the hearing. Okay. If the temporal bone is having high energy, then it's creating very sensitive perception, ability to receive the spiritual message. So temporal brain is having that much power. The person is having ability to receive the spiritual messages. Okay. If we are doing regular meditation and our temporal brain is getting activated, we are developing a different type of the intuitive power. So the low energy may be due to the past or trauma. Trust is the very big factor which is connected with the temporal bone. If the temporal bone is good, the person is having very good trust. If suppose if the lack of trust in the others, if you are having lack of trust in the others, it means the temporal bone energy is getting disturbed, right? So unwanted, unresolved aggression, anger, the feeling of revenge, these all are disturbing a temporal bone. And the high energy or the overstimulation will result exposure to the high frequency sound or the deep spiritual practice leading to increased sensitivity. So the temporal bone is having very direct connection with the spiritual practices or exposure to very high frequency sound and the trust. Many people are having, many male and females, especially females, having headache all the time here. Okay. More or less, there might be some issue which is connected with the trust. Even there are many other things. But as per our organ science, number one, it's very deeply connected with the trust. And number two, it's very deeply connected with the aggression. And number three, with the spiritual practices. How to balance it? So, in the Marma Shastra, what we are doing, from the ear apex, we are going 2 finger up. And we are reaching on this point. And this is the point, exactly 2 finger above from the ear apex. And we are stimulating this point because this is a very good point for the temporal bone. So we are keeping middle finger here, 2 finger on the side. We are pressing this point very gently. Then we do zigzag movement. If the person is having headache on the temple area, we can stimulate this point bilateral. When the patient is coming, so we are stimulating like this. We are keeping middle finger, 2 finger on the side, and we are doing zigzag movement for the patient. In the acupuncture, this point is called gallbladder 8. We can directly needle this point, and this stimulation of this point, whether through the acupressure or with the Marma Shastra, it's very good for hearing and very good for releasing the unwanted stress. So let's see the location of this point. So this is the location of gallbladder 8. We can see near the 1 to 1.5 above from the ear apex. So from the ear apex, we are going 1 inch above or 2 finger above. We are reaching on this point. This point is called gallbladder 8. So we can measure from the ear apex. And this point is one of the great points for hearing, temporal brain. If the person is having problem of mistrust, if the person is having too much daydreaming, we can balance these all conditions by this point, the gallbladder 8. This is the activation of temporal brain. Okay. The second point will be LI4. LI4, I already told you. Where is the LI4? This point is located here. LI4, we already know. So LI4, second, gallbladder 8. And the third and the very important point, that is small intestine 19. Let's see this location of this point. Then all together we will be activating all the 3 points. Then we'll see the effect. So in front of the ear, if we are asking the patient to open the mouth, we will feel the depression here, just in front of the ear. we will see the very clear depression. That is the location of SI19. You keep your finger here and then open the mouth, you will find the depression here. We can see this is the point, SI19. So one point we are stimulating above the ear, one point we are stimulating in front of the ear, then we'll able to stimulate the temporal bone. If you look at the image of the temporal bone, so see here, this is the ear. Okay. So we are stimulating one point in front of the ear. That is the point located in the temporal bone only. One point above the ear, that is also located on the temporal bone only. Upper point is gallbladder 8 and the front point is SI19. So let's see here. Keep your finger, feel the tragus. And in front of the tragus, we will find the depression, then open mouth, close mouth, open mouth, close mouth, open mouth. As you open the mouth, you will find the depression here. That is the location of the point, both the sides. So we have to stimulate this point. How to stimulate this point? Number one, just press and release 15 to 20 times. Press, 1 to 3, release. Press, 1 to 3, release. In this way, we can do 15 to 20 times. And second, we can do the rotational movement here. In both the direction, and we can stimulate for 1 minute or 2 minutes. If the person is suffering with any type of the hearing problem or the problem of smell, not able to smell something, or the problem of the temporal bone, which is the mistrust, or any other problems, then we can stimulate this point, and LI4. So look at now. So gallbladder 8 above the ear, we have seen. SI19 in front of the ear, LI4 in the hands. In the Marma Shastra, Karna Marma, the same point, just we have praised SI19. And the Sankh Marma on the temple area, I will tell you. So Sankh Marma, just again you see the stick of my this specs, where it's meeting the hairline, there is the Sankh Marma. So from the corner of the eyes, if I go to the ear, in between on the hair, this is the point Sankh Marma. Sankh Marma is located on the temporal bone, and we will do the gentle, first touch the point, do the little pressure very gently without giving over pressure, then do the rotational movement. So this is called Shankh Marma. Shankh Marma, one of the great point for even digestion. In the Marma Shastra, it's written, if you stimulate the Shankh Marma, it's to balance the temporal bone, it's to balance the digestion. And I have noticed, sometimes patient is also getting very good benefit in the lower back pain. Okay, right now our focus, Shankh Marma, balancing the temporal bone. So let's see now. Yeah. So gallbladder 8, SI19, and the LI4. 3 point, Shankh Marma and the Karna Marma. 2 point, for purpose to balance the temporal brain, and as per the Ayurveda perspective, Ashwagandha and the Brahmi we can use for calming down the brain and reducing unwanted aggression. If the person is having unwanted aggression, feeling of revenge, aggressiveness, tendency to fight. Then with the help of ashwagandha and the brahmi, we can work. We can do the gentle oil massage on the temple area with the brahmi oil. Brahmi oil is very good oil in the Ayurveda. And listening some calming music frequency, which is also regulating the sensory perceptions. So this was the discussion of temporal brain. Is it clear? Any question? Clear to everyone? Okay. Good. So now let's see, still we are on the brain. There are many part of the brain. So first we will be discussing the brain only. After brain, then we will be moving to the other part. Now, after the temporal brain, we are going toward the another part, that is the back brain or the occipital lobe, back brain, right? So occipital lobe. Occipital lobe means this back side. This is the occipital bone. And if we remove this bone, we will reach on this brain. This is called occipital brain. We can see this is the left occipital and the right occipital. So right and left, two occipital brain. Occiput is the very important part. Why the occiput is very much important part? Because occiput is having connection with the positive or negative outlook. So we can see this person is having positive outlook. And this person is having too much negative outlook. So whether the person is having positive outlook or the negative outlook, it is determined by your occiput. So if the negative outlook on the life or the depressive thought, this is due to the low energy of the occiput. If the occiput is having high energy, then there will be positive outlook and also good awareness. And we know when the two wrestlers are fighting with each other, and during the fighting, if by chance they mistakenly hit the occiput area, in the occiput area we are having visual center, eye center. So it has been observed, if there is a hit on the occiput, there might be some problem with the eyes. Even we are doing scalp acupuncture. In the scalp acupuncture, if the person is telling some problem of the eyes, we are treating the vision area on the backside. So occiput is having very deeper connection with the vision. I will show you here. Even you do Google vision area in the scalp acupuncture. So let's see here, occiput is very deeply interconnected with the vision. Let's see this. I did just Google. See this. So this vision area is in the occiput. Occiput is having very deeper connection with the vision. So number one, positive outlook, if it is having good energy. Negative outlook, if it is having poor energy. And is also having connection with the vision. Okay. So how to balance it? Let's see. Nowadays, there are too many persons, many times, or everyone sometimes is having negativity in the life. we are having some depressive thought. So why the occiput is getting imbalance? Okay, maybe because of the grief, maybe the prolonged exposure of the negativity. Okay, then occiput is going in the low energy. If the occiput is in the high energy, then person is having heightened spiritual awareness, very good visualization. So if we do very good visualization practice, we can develop the occiput energy. What is the visualization practice? The visualization practice means bring your awareness in the beautiful sky. Then you see yourself in the very positive outlook. You look, everyone is having good health, everyone is helping you, you are a very good person, everyone around you very good, you are helping them, they are helping you. Whatever you want to do, you have to imagine, you have to visualize something which is very positive. Or you go in your life, okay, sometimes you have got very good help from someone, or you have done something very good, you go in the life, you imagine that part of the life, and as soon as you will go in the frequency of positive thoughts, your energy pattern will change. So occiput is having, or the back part of the brain is having connection with the positive and negative outlook. How to balance it? So there are 1 point, governing vessel 16, and just on the side of governing vessel 16, there is a bladder 10. Let's see here. Governing vessel 16, I already told you earlier. If we follow this midline and we are reaching in the center here, this is the location of governing vessel 16. And from here, if I go 2 finger on the right side, 2 finger on the left side, this is the bladder 10. So this is the skull. If I feel the border of the skull, then I will find all the 3 points, one in the center, 1 2 finger this side, 2 finger this side. So this is the bladder 10. So I have to place this point, governing vessel 16. I have to place this point, bladder 10. Let's see the location of both the point. So see here. So DU16 or the governing vessel 16 point here, we already seen. Okay, so this is the same point. Now on the side, we are seeing another point that is called bladder 10. Look at here. So this is the DU16. We can see the one pit here. If you go on the side, 2 finger on the side, then there is a location of bladder 10 or the urinary bladder 10. Let's see now. So this is the location of bladder 10 on the side. From the DU16, we are going 2 finger on the side. So we have to estimate these 2 points.
Insertion.
And the third point will be, third and the last point, just 3 points enough. That is DU19. So on the top of the head, we already have seen 1 point, the point of the higher awareness, that is DU20. So from the D20, if we go from the D20, we are going 2 finger down. That is DU19. So initially, we have seen this point, the top of head, that is DU20. If we are going 2 finger on the back side, that is DU19. So this is the point, it's balancing this occiput area. Okay. So DU19, DU16, on the both sides we are having bladder 10. There are 3 points to balance this. So how can we stimulate this point? Let's see now. So first we'll start stimulating the point in this way. The top of the head. Just do the acupressure here 15 to 20 times. Praise 1, 2, 3. Praise 1, 2, 3. Praise 1, 2, 3. Okay. Then from here we are going on the back side. 2 finger down. Praise 1, 2, 3. Praise 1, 2, 3. 15 to 20 times. Then we are going on the depression on the back side. Praise 1, 2, 3. Praise 1, 2, 3. 15 to 20 times. Then we are going 2 finger on one side, 2 finger other side, and we are pressing these both point. Praise 1, 2, 3. Praise 1, 2, 3. Praise 1, 2, 3. And we'll also separate the borders. So we'll keep the finger here, grasp and separate the border. Okay, in this way, if we are separating the border, it's called Simant Marma or border separation. So let's see here now. So governing muscle 16 we have seen from the top of the head. We are going 2 finger on the back side, that is governing muscle 19. Then on the depression on the back side, just on the depression on the back side, we have seen 16. Then on the both side, we have seen bladder 10. So we have seen all the 3 points. Brain center means this. We already have stimulated brain center. And the Simant Marma means borders. Now, as per the Ayurveda, so this is, we are talking about the occipital lobe, occipital brain. And we already told you it's having connection with the aggression. It's having connection with the anger. And it's not, so we are talking about the occipital lobe, which is having connection with negative and positive outlook, not the aggression, sorry. It's having connection with the negative and positive outlook. Okay, fine. So we can see very positive person and we can see very negative person. Now, in the Ayurveda, what we do? Because we want to work on the vision. And occiput is very deeply connected with the vision. We are doing the treatment using Triphala. Triphala is one of the great medicine for vision. Okay. In the Ayurveda, there are many treatments are very famous. Like what we do, Triphala is we are taking in the form of powder. Triphala. Tri means 3. Phala means fruits. So if you do the Google, you will find Triphala. Let's see here. Triphala. So the triphala is the combination of three fruits we can see in this image. One is this is the amla. So harad, vahida, amla, there are three powders we can see in this image. So we are mixing these three fruits and making the powder, and this is called triphala. Now we are taking 1 spoon powder, and 1 spoon powder we are taking and putting in the water. So we can see here, if we are putting the 1 spoon powder and putting in the water overnight or 4 hours, then filter it and put in the eyes. It's a very good for vision. It's improving the vision. It's a wonderful for vision. That is called triphala. Triphala powder is very readily available in the market. The second thing, if we boil the triphala powder in the ghee, and it's become medicated ghee. So in the Ayurveda, we are doing one treatment for eyes. The treatment is called Netra Tarpana. I will show you quickly what is Netra Tarpana. So in the Netra Tarpana, also we are using triphala. We are making this boundary using the floor. You can see this is the floor. So this is the floor, and we are making the boundary using the floor. Then we are applying the floor around the eyes. Then we are putting the Ayurveda ghee, that is triphala ghee. Okay. It's a very good for eyes. So we are using triphala. Even if the person is taking triphala powder, eating the triphala powder, it's improving the vision. So ultimately, occipital lobe is having connection with the vision and positive and negative outlook. So here triphala is for vision and the detoxification. If the person is taking triphala powder, it will clear the stool. It's a very good for stool and motion. We should meditate to bring positivity. And we can do during the sunrise or the sunset, we can do sun gazing, but you should train first yourself. Okay. This is also stimulating the occipital brain because our vision is having direct connection with the occiput. We can activate our occiput using the vision. Okay. So this was the discussion of the back brain or the occiput. Question clear? Everything? Okay. Manish ji, are you there?
सर एक क्वेश्चन था
हाँ.
कि त्रिफला के अंदर ये बड़ा हड्डी लेने का या छोटी छोटी हड्डी आती है वो लेने?
छोटी हरड़. Small.
छोटी हड्डी.
Yeah.
सर त्रिफला का प्रोपोर्शन क्या रहना चाहिए?
I will tell you. Okay. So triphala का proportion क्या रहना चाहिए? So in the triphala, I told you there are 3 combinations. Triphala is very good for occipital brain. Let's see here.
सर त्रिफला चूर्ण नहीं लेके त्रिफला क्रश ले और भिगा के रखें वो चलेगा?
तो क्या लें त्रिफला का? What?
त्रिफला क्रश पीसेस आते हैं ना, एक पीस.
Yes.
हाँ, वो 3-4 पीसेस अगर भिगा के रखें वो.
Yeah, you can take it. No issue. Yes. So in the triphala, first it's readily available in the market. Okay, you can take in the form of powder, you can take in the form of like crush and everything. There are three fruits in the Triphala. Fruit number 1 is called harad. Fruit number 2 is called vahida. And fruit number 3 is called amla. Harad, vahida, amla. So the combination one, we are taking all the three in a 1:1:1 ratio. But if the person is having high pitta in the body or the very high heat in the body, then we can do little change in this combination. What is the change? We can do 1:2:4 ratio. What is that? Means harad will be 1, vahida will be 2, and amla will be 4. This ratio. Suppose harad is 1 spoon, vahida is 2 spoon, amla is 4 spoon. So there are two combinations. Combination number 1, combination 2. If the person is highly constipated, then use this one. But if the person is having too much heat in the body, then use this one. In the market, generally this is available. First one is available, but sometimes if you buy from the market and if it is very old, it's not that much good. It's available in the Amazon also. Suppose if you see now Triphala, you can search on the Amazon and all, it's available. Triphala on Amazon, see. It's available. Triphala photo. Okay. It's available on the Amazon. Okay, done. Any question? Done. Okay. So now we are
Sir,
moving.
one question.
Yeah.
Sir, one question, sir.
Yeah.
This Triphala powder, can it be taken daily basis or only on disease basis?
Triphala powder is not having any side effect and can be taken every day. But
Without.
we
Yes,
can
sir.
take with some like combination, like we can take with honey or we can take with something, right? But it can be taken every day. There is no any side effect of Triphala. Yes.
सर पित्ता ज्यादा है ये कैसे मालूम करें? How will
Pitta means heat, garmi, ushnata, heat in the body. Heat in the body means pitta.
हाँ
In the Triphala, there are three things. So excessive heat in the body means pitta. Okay. So we can, but anyway, if you don't know what is less, what is more, don't worry. Just all the Triphala, whatever the ratio, it's good for you. Because there are three things already mixed in the Triphala and they are balancing your each and every condition. As per the Ayurveda, there are Vata, Pitta and Kapha. So it's balancing everything. Vata, Pitta and Kapha. So don't worry for the how much ratio, what is the ratio should be. Triphala powder itself is good for you in any ratio. Okay. So now we are moving to the organ number 6. Before that, I will do only when you want break.
Yes, sir. Soon.
Huh?
Jaldi.
Okay. So can we break at 2 o'clock after 15 minutes?
Yes, yes.
All of you are comfortable? And break will be for 20 minutes or so?
fine. Only lunch break.
Okay. So after 15 minutes, we'll do break.
So, वो Triphala is churn or something other thing also? What it is?
It is available in a multiple form. It's available in the powder form. It's
Sugar
available in
syrup form also it is available.
powder form, syrup form, tablet forms, and crush forms. It's available in all the forms. Okay.
The tablets are good or powder are good?
Everything good, it should be made properly. if the company is very good and making this with a very good honesty, it's good. Many persons are not making it very properly, then it will not work. Even it will not work. Okay.
So in case
Can I
of
take-
tablet, 1 tablet per day is okay, sir? Or any proportion we have to take?
So I will tell you, I will write here. So Triphala, if you are taking the Triphala powder, so take the 1 teaspoon powder and you can take with hot water or the warm water in the night. It's very good for constipation, and not only for constipation, it's very good for detox and very good for eyes and very good for your occipital brain. So it will bring positive outlook. Positive outlook. So with hot water. Second, we can take 1 teaspoon Triphala powder with honey, 1 teaspoon honey. This can be taken also. You can take anytime. Like you should be little empty stomach. Or you can take in the night. Okay. The third thing, you can take Triphala powder. 1 teaspoon Triphala powder. One teaspoon ghee. Ghee, it preferably cow ghee, but the cow ghee is not available than any ghee. And little crystal sugar. But if crystal sugar is not available, then please avoid this sugar which is available in the market. What is the crystal sugar? I will tell you. We are telling you mishri. Desi mishri. You know this sugar? जानते हैं sugar को? How many person knows this sugar?
Yes.
धागे वाली मिश्री।
प्रसाद में आता है।
So this
Very
is
shakar.
mishri. This is the.
Sir, how about the brown sugar, sir? It is not
But if
like
you are
apple.
taking, if you are taking this sugar, this is very bad. This sugar, please do not take this sugar. This is refined sugar. It's very bad.
Sir,
1 minute, 1 minute.
unrefined brown sugar is there, no, sir?
No, that is also not good.
In the crystal form only, sir.
It's a desi mishri only. This is the sugar.
Good is okay.
Good is jaggery. Jaggery is good. Jaggery is okay. Jaggery is also okay. Okay. Jaggery. But please do not take refined sugar. It's very bad. It's will damage your
So
digestion.
this Paris sugar is coming, which is not refined. That is good, sir?
Not good.
Paris company sugar. Not good. Okay, sir. Thank you.
Sir, palm date sugar is
Whatever
good.
different type of the sugar is coming, they're all bad. I have tried on many of my patients. I've done lots of trial. Ultimately, the people they are developing some digestive disorders and skin problems, constipation, and many other problems. Either you don't take it, or if you're taking, take this what I'm telling you.
Sir, palm date jaggery is good.
पाम वाली भी तो धागे वाली मिश्री आने लग गई ना।
That is good. That is
With
good.
palm.
The
That is
natural
good.
is good. Yeah.
वो थोड़ी काली काली होती है सर, उसका टेस्ट
सर
कंपैरेटिवली
अब
थोड़ा।
आप ब्रेक ले लीजिए वरना लंच नहीं हो पाएगा।
We will take break after 15 minutes. Okay, shall we do break now? Okay.
Any
So
option?
now
Yes, sir.
we will meet by 2:20. 2:20, okay?
Okay.
Well,
Yes,
everyone.
sir.
So
Hmm.
we'll join the same link at the 2:20.
Sir.
Thank you so much. See you. Bye.
Okay.
Sir,
Thank
can I
you, sir.
take that?
Thank you, sir.
Huh?
Hello?
What?
Can I take triple?
Yeah, you can.
Can I take?
Yes,
Huh?
yes. You can also
सर
take.
टैबलेट कितना लेना वो नहीं आया अपना रह गया। टैबलेट लेना है तो कितना लेने का?
Tablet can be taken 1 to 3 tablets. It depends on the person. 1 to 3 tablets, okay? Many person, because Trifla tablet is also doing relieving the constipation. Suppose if you are taking 2 tablets, okay, might be good, but you are taking 3 tablets, it will create loose motion. Then you have to come back and reduce the doses. And there are
So
many,
sir.
there are many medicine available in the market, and these all medicine are not good for constipation. But Trifla is very simple and natural medicine which can be taken regularly for long time.
Morning one, afternoon one, and night one, sir. 3 tablets in a sense.
Only night is enough. Once in enough.
3 tablets night.
Yeah. So start with the 2 tablets, and in the night. But if you're feeling it's too much, then reduce one. But 2 tablets never too much. As per my experience, 2 tablets never too much. Either you have to take 2 or 3. But some person is very sensitive, so for them you have to reduce the doses, right? And
Only in the night you have to take, sir.
Many person even not respond for 3 tablets because they are having very bad digestion. Then you have to consult the doctors and you have to take the proper plannings and all. I'm telling you some general idea which is useful for every person, whether you are doctors, medicos, non-medicos, housewives, general person. Trifla can be taken. It's a very simple thing.
और सिर्फ सुबह में आंवला जूस लेते हैं वो 2-3
Yeah,
आंवले
Trifla is made by 3 fruits. One is amla. Amla can be taken in the morning in the form of fresh juice. It's a wonderful. It's a very good. Yeah.
Apart from amla juice, this Trifla can also be taken, sir.
Yes, definitely it can be taken.
चल
Only in the
आंवला
night
जूस
we have to
लेने
take,
का
sir. On the daytime also you can take this Trifla tablet.
Trifla tablet should not be taken after meal. It should be taken either in the night. The night is the best time. So morning you are having good stool, or you can take empty stomach in the morning. There is no issue. But tablets generally we are not preferring in the morning, because suppose you are taking in the morning, then you are going, you are taking your patient, and they are feeling good. Then in the stomach, then you have to run for a stool. Okay, so it's not good.
Okay. Thank you, sir.
If you are taking in the morning, if you are taking in the morning, then you should have nearby washroom.
सर आंवला जूस जो लेते हैं
हाँ,
उसको कैसे 3 आंवले का हम जूस निकालते हैं
हाँ.
और फिर वो पी के कितना टाइम फास्टिंग रहना चाहिए?
If you are taking the amla juice in the morning, best idea, take the amla and little ginger combination, ginger, and just do not take anything for 1 hour after the amla juice, if you want proper detoxification. Amla is very good for digestion, for skin, for hair, for beauty. As per the Ayurveda, amla is the boon for female. Boon for female.
सर आजकल थोड़ा सा ये ट्रेंड भी है ना कि अभी बड़ा कॉमन चल रहा है कि घी लेना चाहिए सुबह, एम्प्टी स्टमक वी शुड टेक 1 or 2 teaspoon of
Taking
ghee.
the ghee in the morning, this trend from not now, this trend from thousand years. If you in the touch of Ayurveda,
Sir,
for me
what
it's a
type
very
of
normal
problem?
trend. We are even I am seeing this trend from my college time.
So what type of problem it will resolve?
If the person is taking ghee in the morning, like first thing in the morning, if the person is taking ghee or the medicated ghee, it will balance, it will nourish the intestine. Actually, maybe I will discuss after some time. It's a very big topic. What will happen if we take ghee empty stomach? Okay, if we take the ghee empty stomach, it's a very, very important medicine. Okay, and it's
घी लेने का फिर आंवला का भी लेने का वो टाइम भी
actually
बताना।
that thing will be discussed separately, because we have to discuss 41 organs. Okay, if we just discuss only nutrition, then we will not able to cover 41
सर
organs.
आप भी लंच कर लीजिए सर, आपका लंच
So lunch is
रेडी
not necessary. Covering the 41 organ is necessary.
सर ऑर्गन को नरिश करना पड़ेगा ना।
हाँ. So
Sir, please give us the recording.
Recording is not available. Thank you so much.
Sir, please.
Okay. So now, sometimes you should see, no one is having time to watch the recording. Then why are you asking for recordings?
No, sir, we will watch, sir. It's so informative, sir, we have.
Okay, we'll
Sir,
discuss
we
later on.
have the time for time.
Okay, so we'll discuss this later on. Now we'll see at 2:30. Okay, 2:30.
Yes,
Okay.
sir.
Bye.
Okay.
Thank you.
Okay,
Thank
sir.
you.
thank you.
Thank you, sir.